The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. My question is for the Minister of Health. This week, representatives from the Strait Richmond Hospital are seeking funding assistance from the municipalities. The hospital needs $2.3 million to redesign the entrance to the facility. Right now, outpatients wait in the same space as ER patients, Mr. Speaker, which does put them at risk. Those seeking routine care are put at risk when they're with patients who might have the flu or other illnesses or infections, Mr. Speaker. According to the hospital, the Health Authority has offered less than 10% for the cost, about $185,000. So I'd like to ask the Minister, is the Minister concerned that this renovation to protect the health of patients is reliant on municipalities or even private donors?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for the question. As the member noted, the work for capital projects does go through the Nova Scotia Health Authority, which is responsible for the hospitals and the infrastructure providing care to Nova Scotians from one end of the province to the other. The way the process works, Mr. Speaker, is as they assess all of the capital needs that they have for our healthcare system, they bring forward the requests, and we consider what we can do based upon the budgeting process. We allocate a budget as part of that. Our budget was tabled in the spring, Mr. Speaker, and the Health Authority is working within that for their capital decisions.
The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. The amount offered by to the Strait Richmond Hospital by the Nova Scotia Health Authority is even more concerning when you consider that the health capital budget has been underspent by more than $72 million over the course of the past 3 years. The renovation, Mr. Speaker, at Strait Richmond will require only 3% of that unspent funding over the last couple of years. So I'm wondering if I could ask the Minister, why has the government failed to spend the money budgeted for improvements to our hospitals when the communities are at need, like at the Strait Richmond Hospital?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I'm happy to explain to the member and all members of the legislature how capital projects work. Mr. Speaker, these projects are often complex. They do get developed based upon a projection of when work will take place and an estimate of the cost of that work. Frequently, Mr. Speaker, there are delays in that work. That's why the budget doesn't get fully spent in any given year. However, Mr. Speaker, I assure the member that, in fact, the budget does get spent. The timing may just be offset. So the figure that was referenced for the capital budget being underspent in past years, as the Finance Minister has noted in fiscal updates, those delays are based upon delays in the project, but the money gets spent as the projects get completed.